to another episode of Going All In, Get the Edge You Need to Succeed. My name is Dr. Erin McKinley, and today we have a very much anticipated spotlight session featuring Dr. Lisa Trone from the Masters of Science and Dietetic Internship Program at Florida State University. Welcome, Lisa.
Thank you.
Tell us a little bit about you, how you got to FSU, your journey there, everything about you. We want to know everything.
Okay, let's see if this will forward. There it goes. All right, so a little bit about me. So I actually started out wanting to be a physical therapist, and I ended up taking a class that was called Care and Prevention of the Athlete, which was an athletic training class. I initially went to the University of Missouri, and it was just everything I ever wanted to know. You know, I grew up being the athlete and all that, and I ended up transferring to Western Illinois University to get my degree in athletic training. And at the same time, I'd already taken a lot of my prerequisites, and I kind of started thinking, you can't really do a whole lot with sports without the nutrition aspect. And this is a couple of decades ago, so women in sports were not really as prevalent as they are today, especially in the athletic training field. So nutrition was a little bit more of a route that was more feasible for me as a female at that time. So I started taking some nutrition classes, and then I found that Florida State had a degree in sports nutrition. And so I transferred to Florida. So from Illinois to Florida, not only is it Florida where it's much warmer without the snow and ice, so that was a plus. And then I started working once I got my degree from Florida State and got my RD. The main hospital in Tallahassee hired me a couple weeks before I graduated. So, you know, in the past 20 years, I've worked quite a few different areas. You know, the nice thing with dietetics is that sky's the limit. So if you can kind of think it, you can make it happen. So it's not just about working in a hospital necessarily, or even just as a sports dietitian. There's all kinds of jobs that, you know, can come as side jobs. I'm not sure if I've ever had just one job in my entire life. So at the hospital, I worked everything from the major ICU units to the rehabilitation to long-term care. Apologize. And then I ended up going to just rehabilitation. I worked at Health South Rehabilitation Hospital, which is now called Compass, I believe, and got to do a little bit more of my sports side. I got to develop a employee wellness program, and just develop some different programs more for you know, the employees, as well as kind of develop more programs for patients like diabetes education, things like that. And then I kind of wanted to make a little more money, so I became a consultant with Nutritious Lifestyles, where you just kind of travel every day. So I had up to, you know, 8 to 10 different buildings per month. And that's really kind of got my feet wet into long-term care and food service. So even though I got my degree really in the sports nutrition field, I really didn't think that I would end up being an expert in long-term care and food service, but hence that's where we are. I went back and got my doctorate in health science, which is an educational type degree. So it was more learning how to teach. My emphasis was on behavioral change, things like that. So that's where that degree came in. And in the meantime, I've been an adjunct at Florida State for the last 11 years, and I took over as the internship director last year. So it's been quite a year from taking over as the director, and then with COVID, and so it's been a very steep learning curve. Some other things I've done, and I don't even have some of them on here, but, you know, I review menus. I've worked as expert witness, reviewed textbooks. You know, I've worked in fitness centers, boot camps, all those different types of things. So that kind of, I think, brings me up to where I am right now as the director at Florida State. Just kind of moving into the program that we have. So ours is a combined program. So we have the master's and the internship program is combined at this time. So to get into the internship at Florida State, you have to apply to the master's program to begin with. So you have to apply to the master's program by December 15th of this year if you're planning to go into the internship in the fall. And so every year it's only a one-time admission for the internship. And then you have to apply to the internship program by February 1st of the following year, or of the year that you want to be admitted. So a little bit about the program. Again, you have to be admitted into the program, into the master's program. The application for the master's program, you have to have a GPA of 3.0. Usually there's a GRE, but they are waiving that this year. You'll have to submit a statement of purpose, your resume, and 2 recommendation letters. And I have the URL site that takes you directly to the graduate programs page, so that you can kind of decide what you want, or you can look around on that. We have 2 routes with the internship program. So the first one is a master's in exercise physiology with the major in sports nutrition. And the second route is the master's in food and nutrition science with the major in clinical nutrition. So again, those are our 2 emphases, is the sports nutrition and the clinical nutrition. Sports nutrition usually being our big draw. I know a lot of different internship programs have clinical type programs. The sports nutrition is one that is unique to us, and that we've really worked very hard to develop. And I can tell you, somebody that went through this program a little over 20 years ago, where it is now is just truly unbelievable. I'm really proud of the program that we have, and that I get to help take it even further. For the internship program, again, you have to be admitted to the master's program first, which is why it's an earlier deadline. You still have to have the GPA above a 3. So obviously the higher GPA, the better. But I don't believe that necessarily somebody with a 3.8 GPA is going to make a better dietitian than somebody with a 3.2. So it is weighted. The same with the GRE scores. I will be waiving the GRE scores for this year as well, since it is being waived at the university level. So, if you're only applying to FSU and you're wondering whether or not you have to take the GRE, well, you can, waive that if that's for the only place you're applying. What I rate the highest as far as the applicants go would be kind of the last 3. So the personal statement, and believe me, I read every single one of these. The personal statements, what I'd like to see is, I think every dietitian has a story, as to why you got into dietetics, what made you interested in nutrition, and even further into sports nutrition or clinical nutrition, whatever it is that your focus might be. And I kind of like to hear that. I like to know that there's a reason why you want to do this. And then I like to know why you want to come to Florida State, and why Florida State should accept you. It is a competitive program. We always have at least twice the number of students apply as we have spots, especially on the sports nutrition side, is even more competitive. The resume, what I usually look for on the resume is experience, your volunteer time. Obviously, we'll have to be kind of adjusting that a little bit with COVID. I know that volunteer opportunities have not been as easy to get. They're out there, and they're definitely starting to come back around and open back up with some possibilities. But I definitely like to see a well-rounded applicant. So even if your entire dream is to be a sports dietitian, I still need you to be a dietitian first. So I like to see that you've tried to get some clinical, food service, community, as well as the sports side. And if you're on the clinical side, I definitely want to see that you've gotten some type of clinical experience. But again, I need you to be a well-rounded dietitian. Sports nutrition is just a small part of what we're capable of as dietitians. And the RD exam, not a lot of sports nutrition on there, and you never know what kind of job you're going to have to get. You may not get your dream job right out of school, so I want to make sure that everybody graduates from our program is able to get a job anywhere they need to. And then your recommendation letters, you can submit three. You have to submit at least two, and you have an option of a third one that you can put in there. And I like to see a recommendation letter from somebody that actually knows you. So not just, you sat in a teacher's class a couple times a week or online, and they kind of write what I call cookie cutter recommendation letters. So somebody that you've volunteered for, or an instructor that you've gotten to know a little bit better, that you've done, a little bit more with, that can actually attest to your character and who you are, those types of things. And there's the URL at the bottom of this slide as well that links you to the actual dietetic internship page for Florida State. So the rotations that we have, every internship should have, the first three as far as the clinical, the food service management, and the community. We have, I'm not listing hours at this point because we have some changes that are coming up as far as the total number of hours that are going to be required. So there'll be some adjusting going on as far as the total number of hours that will be involved. And then, of course, our specialty rotations. If you're on the sports nutrition angle, you'll do a specialty rotation in sports nutrition. And if you're clinical, then you will do advanced clinical nutrition based on your interests. So the breakdown is basically the clinical rotation. I break it down into two parts. And I have, for all the major rotations, there's actually a pre-rotation, which is virtual, which, this summer has helped a lot with that, getting all that organized, because we had to pretty much do everything virtual. But I like to make sure that, the two biggest fears that I hear from students, and probably that I can even remember when I was a student and an intern, is number one, making sure that I'm prepared going into a rotation. And two, I want to make sure as the director that everybody has the same amount of knowledge coming out. So, unfortunately, not everybody gets the same preceptors, depending on where you go. Some preceptors are better than others. And so the pre-rotation hours basically just make sure that everybody has the base knowledge that you need for each of those rotations to help you not only have the knowledge for the RD exam and study materials, but also to make sure that you're prepared and knowledgeable going into your rotations. So the long-term rotation is only a couple of weeks. I think it's an important rotation because long-term care is unique to any other type of clinical. And of course, since that's one of my specialties, it's hard for me to exclude that. And then, of course, your inpatient hospital rotation, which is your primary rotation throughout all of the different disease states, your, all your different, your pediatrics, geriatrics, all of that. For food service management, you have three possibilities, which is pretty much everywhere. But you can do school food service for K through 12, collegiate, or hospital rotation. So typically, once you're admitted to the program, we sit down and we talk about the types of rotations that you're most interested in. If I can make that happen, then that's what I'm going to make happen. If you're most interested, in, let's say, pediatrics, and then you want to do a K through 12 rotation, then that's what I'm going to shoot for off the top. And then we kind of, it's kind of like a Jenga, where you have to fit everything together with what everybody else wants as well. Community, there's two parts to that. One is a WIC rotation where there's just a few hours of pre-rotation, and the community, again, there's a lot of different possibilities for community rotations, especially in Tallahassee. We do have a lot of community opportunities as well, so it kind of depends on what your specific interests are. And then our specialty rotations, so again, sports nutrition being kind of the big draw for Florida State. We have, in my opinion, exceptional possibilities for the rotations. We have several professional contracts in different sports between baseball, football. So if professional sports is your goal, then we do have the possibilities there. Collegiate, obviously Florida State collegiate is always the possibility, but we do have other universities all throughout Florida as well as other states. Military, some people are interested in that type of sports rotation. We also have a contract with the Olympic Training Center Exos, which is kind of a contract company where the athletes come to them. So, if you're not interested in one particular type of sport, those types of facilities can be a little more of interest. Clinical, just kind of, again, depends on what your interests are. Clinical is wide open. The most common ones that I have people interested in are cancer, diabetes, pediatrics, eating disorders, renal, cardiac, bariatrics. So it just kind of depends on what you're interested in. And if you don't really know, then we just kind of get a nice little mix so that you get a little bit more experience at the advanced level. So at FSU, I actually upped it by 2 last year. So we've always accepted 15, and I increased it to 17 last year. As far as the internship, the dietetic internship part of it, we do have an ISPP as well, which I'll talk about in a second. And we can accept up to 7 interns per year through the ISPP, and that is a rolling admission. So the DI is only once per year. So we only take students for the fall admission. The ISPP is a rolling admission, and I'll tell you how that kind of applies. But ISPP is for if you did not get matched or if you have a nutrition-related doctoral degree. So you have to apply to an internship first unless you have a doctorate. So just so you can, one of the unique things that I like about Florida State is the ability to have different opportunities to get into the program. I think that's definitely one of the biggest scares, especially our students like in the DPD program, are coming out, it's like the DI program is, very competitive no matter where you apply. So, in getting into an internship, we still have a lot more students that are not getting into a program just because there's not enough, spots open for, all of the interns that are applying. So we actually have 3 possibilities for you to actually complete your internship at Florida State. So if you are right here and you're applying to the master's program at Florida State and you get accepted, then you would apply to the internship program in February. If you're accepted, fantastic. Then you start your master's and your internship program in the fall. If you do not get accepted, you can still start the master's program. With our program, you actually take classes the first 2 semesters. So you're not really losing any time, no matter which way you go this way. If you are accepted initially to the DI, then you would start your rotations in the summer. If you're not accepted, you do not get to start in the summer. You would reapply, and then you could potentially start your internship in the fall. But you would lose about a semester. So you would have to go through the following summer versus those that got in the first time would be done in the spring. So the second time, if you applied, if you do not get accepted, then you have the option to apply to the ISPP. So it's a distance program technically, but I do have students that are in Tallahassee completing their program, so, and finishing their master's program. So for the most part, it's the same program. I'm still your director. I still give you assistance. You use our objectives, our contacts, those types of things, but it's a little bit more independent in the sense that you still have to kind of secure your internships versus me securing them. Okay, so just a little bit more about the ISPP. Again, you can only apply if you are not matched to an internship. So if you are only interested in Florida State, then you probably should only apply to Florida State, because if you get matched somewhere else, then you are not eligible for that ISPP option. Again, you can also apply if you have a nutrition-related doctorate degree. But you find the rotations, and they can be local or distance. And then you basically just pay a flat fee. So with the DI rotations, it's part of the curriculum. ISPP, it's outside of the Florida State curriculum, and it's just the internship if you did not get matched. And then just to kind of brag on Florida State just a little bit, we've had a pretty good history of pass rates. These are national, so this is the 2019. And this is my goal. I mean, I think a lot of places have, they've changed the statistics, to represent first year pass rates. So in other words, somebody could take the test multiple times in the first year and it still counts as like 100% pass rate when you look at their statistics. What I want is for everybody to pass it the first time. I know everybody would like to pass it the first time, I would hope. And that's where the things that I'm trying to implement will hopefully get us even higher, but just to kind of show where we rank. Nationally, dietetic internships, this is, 3750 interns took the test last year and 70% passed the first time. For us, 10 out of 12 took the test last year and 83% passed the first time. So, and then our ISPP, I don't know if that's fair statistics, we only had one, that took it last year. So luckily they passed it. So that was either a 0 or 100. So that's good. But, and traditionally the ISPP actually has a lower pass rate. So definitely am looking to do a few more things with the ISPP to get those pass rates up a little bit. And then the last thing that I really have is, and I kind of went through this a little bit, but how do you improve your matchability? I think really with any school. I think every director has to kind of speak to their own program, which is why I think that should be the first thing you do is contact the internship director and talk to them about what they're looking for in their program, making sure that you have all of the application procedures that are supposed to be done. I'm sure probably Erin can maybe attest to some of these, last minute, like I didn't know I had to turn that in, or I'm still waiting on, recommendation letters, things like that. So, you want to make sure that you have all of those, processes, knowing exactly what you have to do and get everything in and make sure that the internship director knows who you are. It's nice to put a face to a name, or at least have talked to you on the phone. So I get some idea of your personality, just to see you on paper, compared to me being able to talk to you. One of the big questions I always get is, do Florida State students get priority into the internship process? And so technically, no. I mean, it still comes down to, how good you are, as far as your GPA and your recommendation letters. But what does help is that we get to know them, so knowing their personality, knowing what kind of intern they're going to be. And so to match that, I think at any school, the best thing you can do is contact the internship director and make sure that they, know you and, know that you've got your act together. And so that when your application comes in, they can kind of put a name and a personality to just the paper. If you can visit the school, even if it's virtually, I know that's a little difficult right now, but I don't know too many directors that wouldn't take time to, do a Zoom call to at least, talk with you about the program. Usually they can set up, Zoom meetings with professors if you're interested in talking, especially if you're interested in research. I didn't really mention, if you're into the research side, a lot of times students that do internships don't do the research side of it just because it's a lot, but we do have students that do both. And FSU is a very high-ranked research facility. We have multiple labs. So if you're interested in those types of things, we can always connect you to professors that are doing research and you can talk to them. And the other thing is students in the program. So, one of the things once you're in the program is I match you with a mentor, somebody that's already in the program. But, first you got to get in the program, right? So I have had, students that have asked, is there a possibility for me to talk with somebody who's already in the program? It's kind of like, when you get a job, it's always good to talk to the person that's leaving or somebody that already works there, right? To see what it's really like, as far as what actually goes on the inside. And so I think that's a good thing for you to recommend or to ask if that's possible. I know I would certainly try to make that possible for you if you ask me. Again, I've talked about the experience, the volunteering, the recommendation letters, personal statement, and then your GPA and the GRE. Not that they're not important, but I definitely think that your personality, how much initiative you have, your drive, all of those types of things make you a better candidate that I know you're going to get through, the rigor of doing a master's degree and the internship at the same time, and you'll get through it well. You're going to pass the RD, you're going to get a great job and live a happy life. So, all right. So that was my spiel. So what questions do we got?
All right, that was awesome. So I have 5 questions that I ask every director that does a spotlight session with me, and these questions were put together with the help of some of the students here at LSU. And you kind of touched on this a little bit with the personal statement, but what is one thing in particular that you just really love seeing on a personal statement?
I love seeing, kind of going back to just being well-rounded. So again, I know that the sports nutrition is a big draw, but if all I see is that you've done exercise phys and you know what I mean, like you haven't really ventured out into the world of dietetics and you've just been in this little corner of sports, I like to see somebody who's really looked at the bigger picture of dietetics, because it is a gigantic field. The amount of knowledge that we're required to have, and I think you need to see the bigger picture in order to even just do well in your one little corner. So that's kind of what I'm looking for, is that you've the experience, whether it's volunteering, whether it's going to seminars, whatever it is, that you kind of branched out. And you know, I always tell my students, you've got to get into the unknown in order to improve yourself. So I want to see that you've gotten into some areas that maybe you're not as comfortable with, you know, other than the sports side or just the clinical side. I know food service is not everybody's favorite, but, you know, getting some of that experience, that there's a reason why we have the 3 main branches of dietetics is because they're all interrelated. And there's really not, especially sports nutrition, guess what that involves? A lot of food service, a lot of community, and the clinical and the sports side. So.
No, that's good. I like that you mentioned that, because I think a lot of students are under the impression that if they are going after a sports program, they should be dedicating a majority of their time to sports. But I do agree with you that they should be getting a little bit of everything, because they still do need to do that when they get into an internship. So I like that.
Yes.
So the second question is a true or false question. An applicant's resume should always be 1 page and 1 page only. And either way, why?
False. And you know, if you'd asked me before I was the director, I might have had a different answer for that. You know, I used to teach the resumes, and, you know, everything you read is they should be a page. But, you know, when you're trying to get all of your experiences on there, which is something that I'm seriously looking at, you know, as far as the applicants, you know, if it's worth reading, I'm not saying it should be 5 pages now, but, you know, I think if you have to go to 1.5 pages or 2 pages to get the experience that you need on there and to get across, you know, what there is, then I think you need to do it.
All right. That is good advice as well. All right. Third question. What is one thing that an applicant may do that you look at as a total deal breaker? So something that may maybe put in their personal statement, in their application, maybe in meeting you, something that they could do that you would raise a red flag for you, that you wouldn't really want them in your program.
Disorganization. So, you know, I've had people, you know, like I make time to, and believe I have no problem making time to meet with anybody. I will take all the time I need, you know, all that. But when, you know, especially as a director, I mean, we're busy people too. So if we take time out of our day to talk to you on the phone or a Zoom meeting, and then you are completely unorganized, you have, you know, like, oh, well, let me see, you know, I want you to bullet point those questions, go right through them. Let's get through exactly what you want to know. You know, not getting your information submitted on time, or it just seems like it tracks with certain people. And you can kind of see that trend. And I'm not saying you can't make a mistake, like you got, there's been times, like, cause I'm in, you guys are in Central Time, I'm in Eastern Time. There's been times we've made meetings and we're like, okay, we were in a different time zone. It happens, you know, but I'm just talking about the trend of, you know, it's apparent to me that you're disorganized. You can kind of tell that even in your personal statement when you write, like it's all over the place. And so when I start to see that trend of being unorganized, disorganized, I know that person's going to have trouble, because there is definitely some timelines, you know, involved in the internship and the master's degree, and you've got to have time management.
And I will say our 2 students that are in your program right now, organization was, they impressed me, and I'm the most organized person ever. So I would definitely agree with you that they need to be organized. All right. 4th question. What is one area of the program that you're actively working on trying to make even better for the interns?
Can I say two, or do I only have to do one?
As many as
Okay, so there's definitely, being, only here for a year, there's a lot of things that I want to implement. But, there's some things that I can do kind of quickly. There's things that I know are going to take probably a few years to get done, because I can't just implement them on my own. But the things that I've already implemented, being a preceptor for, the last 20 years as well, I think has given me a lot of insight. I think our previous two directors were really more academic. And so I think I give the insight of actual work experience, into this program. And so I've redone a lot of the objectives to make them a little bit more functional, instead of, and making sure that the preceptor is not trying to decide what it is that you're supposed to be doing either. So it's not vague. It's, this is what you do, kind of thing. And then as far as future, the two things that I'm really working on is, part of it was developing those pre-rotations. I've also, I'm implementing with the incoming class this year. So you'll have to take like a sample RD test, before you exit, which is common in some institutions, but really, really making sure that people are prepped for the RD exam. So I've heard some comments with that they, even though we've had good pass rates, I think if we just provided that little extra, at the end, I think the pass rates on the first attempt would go up. And so that's one of my goals. And the other one, again, is just more practical experience. We have a huge nursing school, and they have a simulation room, and we have never even tried to use it. So that's one of my goals once we get past the COVID stuff, is to really get it a little bit more family oriented, as far as I know that the students, form, bonds because they go through the program together. But, I think there's more to it than that. I mean, you should live and breathe dietetics for 2 years because that's what you want to do. And so, being able to get together and really practice, talking to patients, or how you would talk to a patient, even if another student. One thing, I teach the advanced M&T class, which only the DI students take. And one thing I did this year, since we're not in person, is I'm having them, we use EHR Go, which is an online electronic platform, basically for case studies. And I take those case studies, and they interview the DPD students as the patient. And so the DPD students get some experience, because they know just enough to be dangerous, as far as asking questions, but it gives the DI students, a little bit more experience of actually interviewing somebody, doing educations, and not really knowing what people are going to say, because people do say the darndest things. And so that's the other area that I really want to develop, is making sure that we get more experience in, being able to actually interview people and feeling comfortable with doing educations and all that, even before you get to your rotations.
Awesome. Those sound like amazing things. So my last question is a two-parter. So the first part is, what would be the 3 best adjectives or descriptors to describe your program?
They've all been very easy up to this point. Let's see. I would say competitive. I would like to say, and at least where I want it to be, is rigorous. I want this to be a difficult program to get through, because I want you to, when you come out, it means something that you've graduated from this program. And the last one is rewarding, I think. Again, I don't know if we're 100% there, but that's how I want to describe my program. And when you're done, that you feel confident and rewarded that you have actually, you did it.
All right. So the second part's very similar. 3 adjectives or describers to describe your ideal applicant, dream applicant.
Well, obviously I have to go with organized. Being a very organized person myself, we definitely need to have some organization. Time management, which I know kind of goes along with the organization a little bit. So I'm going to tie those together, make that one. Second one is going to be personality. I really put a lot into personality. I'm a huge public speaker. I love public speaking, and believe it, which I know a little weird, but believe it or not, when you interview, when you do all those things, education, that is public speaking. You know, when even as a manager, when you give in services, all of that is public speaking. It's not just necessarily, you know, getting up in a national platform. So the one thing that I see that most people do not do when they interview or they have to give little speeches is they do not bring their personality. There's so many great personalities, and you guys, most people just kind of clam up and they just, so I want to see some personality, you know, in the people that are applying. And I think dedicated would be the third one, because, and I think that's where I get to the well-rounded area, you know, so if you love dietetics, if you love the field of nutrition, you're going to be happy doing no matter what it is that you do. The chances of you getting your dream job, you know, kind of slim coming right out of school, let's just face it. So you might have to take a job that is not sports related, or, you know, you may not be, you know, the director of sports nutrition of a major, you know, professional team coming right out of school. So, but if you love nutrition and you're dedicated to this field, you just can't go wrong. And so that's what I want to see.
Awesome. So we have a question in the chat from Lakeland. She asked, are there any big projects that occur during the year within the community that the interns can assist with?
So I have a great answer for that. So I actually got one of the things that you have to do during your community rotation is a community health needs assessment, which is a pretty major project. And usually I let my community preceptors handle that, because your hospitals have to do those every 3 years, and so you can kind of help participate in those. This year is a little different because all of a sudden, you know, we didn't have these rotations available, and I had a gentleman call me from a rural area around here, and basically was telling me that they're having a big problem with diabetes. A1C levels keep going up. Again, it's rural areas, rural counties. They also have gotten, I don't know if anybody's ever heard of AHEC, and probably can't remember what exactly that stands for, but we use Big Bend AHEC here, which is an organization that basically does a lot of education in diabetes, smoking cessation, things like that. So we've kind of partnered with them as well as our major hospital here. And so I took all of the interns basically that are doing community rotations this semester, and I got everybody together instead of them doing kind of individual things. And we basically said, here's what we're doing. So we are going to do diabetes management in these rural counties. So I need you to guys go out, get all the data, figure out what it is that we need to do, what kind of education, what is it that, you know, Big Bend AHEC is doing, because they don't have dietitians involved. So they're giving some nutrition advice, but obviously we can go above and beyond. And so we've basically, in their action plan, what they've done is we're offering one-on-one counseling with supervision to anybody in their programs to get more individualized diabetic education. We've also put together videos, like less than 5-minute videos on different nutrition topics, you know, whether it's just like what is A1C to, you know, portion control to, you know, again, just really short videos. They've also done kind of bringing in some of the sports side. They've wanted to get some exercise videos. So we put together a bunch of really short exercise videos. It's a predominantly elderly population as well. So, you know, how to do a squat safely, or, you know, things that the elderly could do, you know, at home as far as helping with their physical activity. They partnered with our hospital, a major hospital, in doing a grocery store demonstration. They actually had it like videoed professionally and everything, doing cooking demonstrations, all kinds of really interactive stuff. And it kind of brings joy to my heart that they can actually see the fruits of their labor. You know, so, and these are things that are actually going to be used for years to come. So the things that they're putting together now. And so I'm hoping that we can continue to find projects like this, you know, where you can, instead of just kind of piggybacking on something, or, just kind of walking through it, you can actually change the lives of people in the community, which is what community nutrition is about. So that's kind of what we've done in the area. But there are a lot of community programs. We've got like Second Harvest and a lot of different programs like that in Tallahassee as well.
All right. So Meredith asked, are all of the rotations in Tallahassee or in the area, or are there opportunities to travel to other areas?
Definitely opportunities. Typically, food service and community are typically done in Tallahassee for sure, because they're usually done during the semester that you're also doing some of your master's degree work. So you have some coursework and that, so they kind of have to be in Tallahassee. The main clinical part and then the sports part are open to other possibilities. So especially the sports rotation, we don't have professional teams in Tallahassee. So unless you want Florida State University athletics, you're going to have to travel. So but the possibilities are, I think we've got some pretty nice options for, your sports rotations. And then clinically, depending on, how it all works out, a lot of students like to go back home, where they can live for free and do their rotation, there. And we do have a lot of contracts all over the U.S. And if I don't have that contract, I will be trying to get it. You said we have 2 students right now that are probably going to be going to, I hope I say it right, Oshner. Is that right? That's one. So both of them are going to be coming back home to do their clinical rotations there. So you have both opportunities. Just depends on what you need.
All right, perfect. So Lakeland asks, what are the graduation and program completion requirements? What are you using as markers for that?
So for graduation is you have to complete the curriculum. So I know I sent Erin the 2 curriculums for the MSDI for either the exercise phys or the food and nutrition. So you have to complete the whole curriculum for that. Included in the curriculum is the DI. So it's like an 18 credit hour class, if you will. It's just that we divide it up throughout the semesters. So once you complete all the curriculum for both of those master's degrees, technically that's completed. And then and for me, for the program, you have to complete all of the hours, mainly all of the competencies that are, embedded into those hours. And you have to, for every competency, we basically have to have a way to determine that you've met the competency. So you have to get at least a 3 out of 5 on all of those different competencies, which are project-based assignments, so to speak. And once you have done all of that and done all your evaluations, then I can give you the DI verification, and then you can take the test and live your life.
All right. So once an applicant's been accepted, what knowledge and experience do you expect to see when they arrive on day 1?
Well, first of all, one reason why we don't shove you right into rotations on day 1, because it is all new. Going to the master's level is a big difference. We do expect significantly more at the master's level, just like if you go to the doctorate level, you're going to be expected even more, at that level as well. So the coursework is more, the knowledge level. How I always explain it is at the bachelor's level, to me, the test questions are like, A plus B equals C. When you get to the master's level, now you're incorporating A plus B plus C plus D, might equal F or G. You know what I mean? So you're incorporating multiple areas to get to an answer versus it kind of being a straight line. I definitely think the master's degree helps us with our statistics. I think that's one reason why our statistics are better with, taking the exam, because we have that extra knowledge of this whole master's degree on top of the internship itself. So from day 1, I just expect you to do what I ask, which is, if I need something, respond to me. If you email me, I'm going to email you as quickly as I can. I expect the same in return. If we have a meeting, I expect you to be there. Like I said, you'll be assigned a mentor, of somebody that's already in a program, so they can help you with a lot of the, base questions of how you, function and get around and campus life and all those types of things. So I don't know if I expect a whole lot from day one, but definitely once you get into the internship, I expect you to be on it. You should be, I'll give you all the information, but you've got to be in contact with your preceptors. You need to get all the onboarding requirements completed, and so forth.
All right. So Meredith asked, you had talked about being well-rounded with volunteering and working in all areas, but for sports specifically, is there any specific sports experience that stands out to you?
Not necessarily. I would say the most common experience is that you've worked with, I know LSU, obviously has, a couple of sports there. They're all right. Yeah, right. But, obviously, most people volunteer with the sports dietitian, there is the most common. If you go out of your way to do something else, to me, it's all experience. I don't know if everybody has, the financial means to travel. And, so I'm really just looking for people that are doing what they can in order to at least know that this is what you want to do. I mean, it sounds great, right? And believe me, I've had a lot of people that have come into the sports nutrition program and did not leave sports dietitians. I mean, they were, I just had one that graduated, and he got a job right away out in California working in an eating disorders clinic because that's what he fell in love with. And the other big question I get is, if I graduate in sports dietetics, do I have to do sports dietetics? No, you can do whatever you want. You're an RD, and that's kind of the point, is you're an RD first, and then you're a sports dietitian, or then you're a specialist in whatever you want to be. So.
All right. So you touched on this a little bit, but maybe you can give us a couple of more specific characteristics or experiences you've seen in applicants that stood out to you from others.
So I would say the ones that stand out, and I'm not going to lie, and I don't say this to intimidate or scare you or anything like that, but I will say the sports nutrition applicants, it's impressive. I'd like to think that I was a pretty good student back in the day. I was well-rounded, and, I had the high GPA and all that stuff. I'm not even sure how I would stack up these days to some of these applicants. You guys are pretty amazing, between, getting these amazing GPAs, all the experience that you're doing, plus you're volunteering, you're like these good Samaritan people. It's kind of amazing what you guys are able to pack into a day. I think that I'm busy, but, it's really kind of impressive when I see people that are just able to get it all done. They've got the GPA, they've got experience, and they've got the personality to go with it, So, sometimes your 4.0 students, maybe they're a little dry, or, because all they do is study, or, however you want to characterize that. But it just impresses me that students come in with these really bubbly, amazing personalities, but yet very dedicated, very, time management, organized. So I think I'm kind of looking for the whole package as far as what stands out versus, just having done a ton of experience, but you let your grades slide. There has to be a perfect balance, and a lot of attention has come to mental balance as well, and you are going to get pushed when you're in this program because you're doing a master's degree and a major internship at the same time. So, keeping that mental focus, and you're not, having a mental breakdown, sometimes, especially in the midst of everything going on, I like to see somebody that's well-grounded. I think that's about it.
All right. So the last question we have in the chat is roughly how many people apply to the program each year?
We usually have around 40, usually is about the average.
And is that just for the DI portion, or is that for the first master's round?
No, that's just to get into the master's, you just have to meet the minimum requirements, and there's really no minimum to get into the master's. So if you've got a 3.0 and you've met all the prerequisites, then you're in. And they'll tell you, you don't have to wait. Usually they do a review like weekly or monthly or something like that of all the applicants, and then they'll let you know once you're in. And then, so getting into the master's program, if you're applying to the DI program, you should not have any problems getting into the master's program. It's the internship that is going to be more of an issue because we have only so many spots that we can accept. But I do want to mention one thing just as a prerequisite for those of you that are interested in sports nutrition. Do make sure that you've had a exercise phys class with the lab, okay, because that's a prerequisite. You can come to Florida State and start the master's without it, but you will have to take that the first semester, and it will throw off your whole timeline. It'll actually probably take you a whole extra semester of school just because you have to start with that undergraduate one. So if you have not, that's the route you want to take, the master's in exercise phys, if you have not taken an undergrad exercise phys with the lab, you need to make sure you get that in before you come, if possible.
And I'm glad that you mentioned that because we now, when folks get in, you guys prefer the sports nutrition class. We don't have one at LSU, so we actually have bent the rules for folks to where those students can take a sports nutrition class from FSU and transfer it over. However it works, usually we don't allow seniors to take classes elsewhere. We have made a new kind of special rule for these types of programs to where if classes away from LSU are needed in order to start right away or start on the right track with their master's or their internship, we can do that for you. You just have to talk to me about it. But thank you for mentioning that. I forgot that when Allie and Lexi came in last year, they're like, can we please take a sports nutrition class? I was like, oh, okay, let's figure out the paperwork on that. But we got it all covered for future generations.
Yes, because all your exercise classes are like, they're, one's in the fall, one's in the spring. So if you have to start with that undergrad, then it pushes everything back, and it's kind of a mess. But so it's much easier if you just have it.
It's cheaper if you do it here. So get it done while you're still with us.
There you go. Yes.
All right. I don't see any more questions in the chat. I'm going to open it to anybody want to ask a question live and not in the chat. Not seeing any brave souls. That's totally fine. So we're going to wrap up. And what is your final message to potential applicants? One final message.
No fear, push yourself into the unknown. In my life, I feel like I've been successful in my life by pushing myself into areas that I was interested in, but was scared to death to do, but once you get in there and you get the experience, so no matter how intimidating, I can't really say Florida State would be intimidating for you guys because you're already at LSU, so it's not like you're coming from a small university. But, the master's program might be intimidating or just the application process. I think life takes you where you're supposed to go. So, go with the flow, be brave, and whatever happens, it's meant to be.
All right. Those are awesome words of wisdom. So thank you for being with us today. And for those at home, if you want more information on the program at FSU, I have included the link to their program in the description below this video. As always, don't forget to like this video and follow my YouTube page to check out all of the spotlight sessions we have with dietetic internship programs. And we'll see you next time. Thank you.
I just wanted to say thank you, Erin, for doing this. I hope you guys know how awesome she is for getting all this organized.